Hello, I am Nadine Carty-Keynes, and thank you for joining us at the Nevis Emergency Operations Center, EOC, today, Monday, 22nd June 2020, for an update on the situation regarding the novel coronavirus, COVID-19, here on Nevis. I want to take this opportunity to welcome all our viewers and media houses that have joined us. All questions will be taken at the end after each speaker would have presented. The Nevis COVID-19 briefing will be aired on Mondays at 8:30 p.m. on Nevis Television, or you can check the YouTube channel and Facebook pages of Nevis Television, Nevis HPU, and Nevis NDMD. Also, the briefings can be listened to on Von Radio every Tuesday at 1 p.m. We have with us today Mr. Brian Dyer, Nevis EOC Director, Mr. Lyndon David, Superintendent of Police, Nevis Division, Dr. Judy Nisbet, Chair of the Nevis COVID-19 Task Force, Ms. Hazel Brown, Public Information Officer, Water Resources Management, Ministry of Communications, Ms. Danella Claxton, Principal Education Officer, Department of Education, and finally, Mr. Huey Sargent, Permanent Secretary in the Ministry of Agriculture, et al. I'd now like to welcome Mr. Brian Dyer, who will provide his updates.
Good evening. There are no tropical weather system in our region. However, you may have recognized the thick plume of Sahara dust affecting our islands. This had prompted the Antigua Met Services to issue a special Sahara dust air quality bulletin. And the bulletin reads, air quality index on particulate matter 2.5 and 10 concentration. The synopsis, the air quality index remains at unhealthy levels for sensitive groups as a result of particulate matter associated with the Sahara dust streaming across the area. This reduced air quality will keep the risk of health problems elevated for mainly sensitive people, such as asthmatics. There is the potential for the air quality index to return to unhealthy levels for all persons, not just the sensitive group. Notable improvement are expected tomorrow. The air quality index showing 90 to 140. The alert level is 3. The sensitive group include persons with respiratory or heart disease, the elderly, and children within this group. Health implications: increasing likelihood of respiratory symptoms in sensitive individuals, aggravation of heart and lung diseases, premature mortality in persons with cardiopulmonary disease, and the elderly. Caution: everyone should exercise caution, especially sensitive groups such as active children and adults, and people with heart or respiratory disease such as asthma should limit time outdoors and restrict outdoor activity. Also, keep windows closed, doors closed as much as possible, and wear face masks rated to filter out particulate matter 2.5 when going outside. So again, I'd like to appeal to persons. Yes, we are supposed to be wearing masks for COVID, but it is particularly important that you wear your face mask that is rated to filter out particulate matter 2.5 to wear your mask at this time to reduce the impact of the Sahara dust on your health. Moving on, the Nevis Seaports Authority has provided some statistics with regards to the movement of persons in and out of the Van Sam International Airport. For the period 16 June to 20 June, there were 25 persons repatriated from Nevis, and 14 persons or returning nationals arrived during this period. The total to date, 256 persons has departed the island of Nevis. For some statistics with regards to the COVID Compliance Task Force, They have inspected a total of 608 facilities. This can be broken down: bakeries and delis 7, banks and financial institutions 13, buses, taxis and ferry 20, game room 2, gas stations 9, government building and departments 101, laundromats 3, market vendors 4, mechanic shops 17, offices 80, pharmacies 2, restaurants 22, saloon and barber shops 21, shops 28, snackets and bars 80. Snackets and bars that's 59, stores 60, street vendors 11, supermarkets 7, funeral homes 2, gyms 2, car wash 3, wholesale 2, radio station and communications 2, manufacturing 9, churches 79, revisits 43, total 608. And this included the polling stations of 23 when we had the general elections. So that brings us to the end of my presentation. So I'd like to say a special thank you again to my colleagues in the EOC, especially the Ministry of Health and the ladies who surprised the men on Friday with our Father's Day gift packages. So thank you again.
Thank you, Mr. Dyer. I'd now like to welcome Superintendent David to provide his updates.
Good evening all. Thank you, Nadine. Once again, it's a pleasure to be back here to give you brief information as to our operations and certain guidance and restrictions. Thus far, we have conducted 966 patrols, 84 VCPs. We have arrested 40 persons for curfew breaches and 10 were charged. 13 crimes were committed and 14 persons arrested. We have conducted 2,913 vehicle stops and 11 persons were informed that they will be summoned for the necessary breaches that they committed. Just a reminder to persons in terms of our day of limited operations, and it speaks to from 5 a.m. to 11:59 p.m. So businesses, you have to ensure that persons are out of your businesses in order to meet the curfew period at midnight. The night curfew, as said earlier, from midnight to 4:59 a.m. All educational places of instruction, they are still closed. So we are expecting that persons should adhere to these and do not encourage children to assemble at various locations for educational purposes. We realize that there are a number of persons that are going to the beaches, but we are saying to you, there shall be no picnics, no beach parties or other gatherings wherein there will be a breach of the protocols in terms of social distancing and physical distancing. Remember, your health is something that you should protect. During the day of limited operations, we know that restaurants and other food vendors are open, but we are saying to you that the regulation stipulates that you should close by 10 p.m. I am encouraging all businesses to continue to comply with the COVID-19 enforcement unit. Ensure that your businesses are complying so that you can continue to remain open and gain the necessary revenue to pay your bills and your employees. We're encouraging persons to continue to wear your masks in open places or public places, and therefore your nose and mouth must be covered. I will like to say at this time, just a bit off COVID, we realize that there are a number of persons who are riding motorcycles, and you think it's best to ride with one wheel on the road and the other is in the air. It is very dangerous. You rest that motorcycle down and you feel awkward. You can fall in front of a moving vehicle and you can be crushed, seriously injured, or you can be killed. We're encouraging you, drive or use the road with due care and attention. So to wrap up, I take this opportunity to thank God for his continued mercies and blessings on our federation. We have not seen any new cases, and we know that he will continue to protect us. I want to thank the governments, federal and local alike, the staff at the Royal St. Christopher Nevis Police Force, Nevis Division, medical staff here at Nevis for your continued support and hard work, personnel at disaster management, other essential workers for your work throughout our island of Nevis, and you, the good citizens who continue to ensure that you're keeping yourself safe, providing information to the police wherever you see breaches, so that we can continue to go and address them. And we are saying to all the violators, remember, we're dealing with something that has killed so many people around the world. Do not be a statistic, but be a part of the solution. Help us to continue to protect you and our families. Thank you very much.
Thank you, Superintendent David. I'd now like to welcome Dr. Judy Nisbet, Chair of the Nevis COVID-19 Task Force.
Thank you, Madam Chair, and good evening to everyone. The World Health Organization reports that as of 2 p.m. today, June 22nd, there are 8,860,331 COVID-19 confirmed cases globally and 465,740 deaths. The region of the Americas continues to be the most affected presently, with the U.S. accounting for most of the cases, having about 2.2 million confirmed cases and over 119,000 deaths. And Brazil, with 1,067,579 confirmed cases and 49,976 deaths. Both countries recorded over 30,000 new cases in the last 24 hours. On Nevis, 124 persons have been tested, 120 of whom tested negative, while 4 tested positive. All cases are fully recovered, and therefore there are no active cases. There are 12 persons currently in quarantine, while a total of 242 persons have been released from quarantine. There are no persons in isolation. The 12 persons placed in quarantine is the only significant change to our statistics. These persons are nationals and residents who have returned home and are housed in a government-assigned quarantine facility and have been placed in quarantine because of their travel history. They are being monitored daily by our health professionals, as all persons in quarantine are, for any symptoms or signs suggestive of COVID-19. On a different note, as Mr. Dyer would have said, we have all noted how hazy it has been over the last 2 days. This is the result of a plume of Sahara dust that has traveled from the Sahara Desert and is now over the Caribbean area. And according to the Weather Channel, it has the highest concentration of dust particles observed in this region in at least the last 50 to 60 years. It means then that the air quality is poor and can adversely affect persons who are asthmatic and those suffering from other respiratory diseases such as chronic obstructive pulmonary disease or COPD. Those suffering from cardiopulmonary disease, the elderly, and the children. Persons with allergies will also suffer. They may develop symptoms such as trouble breathing, excessive sneezing, swelling of the throat and eyes, coughing, watery and itchy eyes, runny and stuffy nose. In fact, because of the poor air quality and that the quality of the air is so unhealthy, it can potentially affect everyone and not just these groups. And therefore, those who aren't usually susceptible to allergy issues can also experience the symptoms that I just outlined. It is advisable then that persons with heart disease, chronic respiratory disease, such as asthma and the COPD, children and the elderly, it is advisable that you stay indoors as much as possible. Avoid the outdoors. All persons are asked to avoid prolonged activity outside. Stay in and keep your doors and windows closed as much as possible. And as Mr. Dyer would have said, wear a mask. You're wearing a mask now for COVID, continue to wear a mask. And more so one with a particulate matter 2.5 filter. And that's similar to the one that was being distributed by the NIA, or is still being distributed by the NIA. And it looks similar to this one, and if you would notice, it has PM 2.5 marked on it. So if you don't have a mask like this, any mask will do to filter out the dust, and therefore, please continue to wear your mask. Please continue to monitor and to protect your health. Thank you.
Thank you, Dr. Nisbet, for your sound advice. I'd now like to welcome Ms. Hazel Brown, Public Information Officer, Water Resources Management, Ministry of Communication, to provide an update.
Good evening all. My name is Hazel Brown, Public Information Officer for Integrated Water Resource Management Unit within the Ministry of Communication Works et al., under the directorship of Mr. Floyd Robinson. We all know that water is essential for everyday use, hence why we should ensure that we conserve our water, especially during the COVID-19 pandemic and the dry season. Washing of hands is a key component in the fight against COVID-19. PAHO released a video on how we should wash our hands to conserve water. Kindly take a look at this quick video clip.
Wash your hands with soap and water. Having clean hands reduces the spread of diseases like COVID-19. Let's show you how to do it. After wetting your hands, close the tap. Add soap and lather your palms. The back of your hands, between your fingers. Back of fingertips in your palm. Your thumbs, the tips of your fingers in your palm. And don't forget your wrists. Use a tissue to open the tap, as this was last touched by your unwashed hands. Rinse your hands thoroughly. Finally, use tissues to dry both hands and discard in the bin. During this 50 seconds of hand washing, we had the tap running for only 7.5 seconds, saving 85% of water otherwise wasted. Water is a precious resource, and in some countries, it is scarce. So as you wash your hands, don't waste water. We are PAHO, and we care.
In addition, I offer the following conservation tips. Find and fix easily corrected household leaks. This can save about 10% on your water bill. Leaks are commonly found in your toilets, faucets, and irrigation systems. Find and fix easily corrected household water leaks. This can save about 10% on your water bill. Leaks are commonly found in your toilets, faucets, and irrigation systems. Take shorter showers, 5 minutes will do. Turn off tap while lathering rags, and turn on and rinse. Use a cup while brushing your teeth rather than running the tap. Reuse washing water, dishwater, washing machine water to water gardens. Ensure washing machines and dishwashers are completely loaded before you turn them on. Water the plants. Water the plants during evening or early morning hours to reduce evaporation. For any emergencies, please contact the Nevis Water Department at 869-665-9061 or 869-763-5319. Remember to conserve water every day. The water you save today will be the water you need tomorrow. Thank you.
Thank you, Ms. Brown, for your tips from the Nevis Water Resources Management. And now I'd like to welcome Ms. Zanella Claxton, Principal Education Officer, Department of Education.
Good evening. I am pleased to announce that 7 of 8 schools have now been onboarded to Microsoft Teams. Gingerland Secondary School, along with all primary schools, and Cicely Brown Integrated School. Charlestown Secondary School will be onboarded shortly. For persons having any challenges with onboarding or signing in on Microsoft Teams, there is a help desk available at help.caribclassroom.com or 765-5473. We're asking all parents to be patient as the help desk is serving both St. Kitts and Nevis. However, they will respond to all of your needs. All schools which have been onboarded had Parent-Teacher Association meetings prior to signing on. And during the sign-on days, we discovered that there were additional device and internet needs. We are working assiduously to serve those needs. We also noted that Kindle devices need additional steps to download Microsoft Teams. As such, the Department of Education was opened last Saturday to accommodate parents to assist them with the download. This will continue on a needs basis. The prospective teachers course applications have been received, and this year's course will take the form of mixed modality with a face-to-face and Microsoft Teams. This will ensure that we adhere to the safety protocols, as well as to ensure that we are exposing incoming teachers to the new platform. The CXC examinations, CSEC, will take place from July 13th to August 4th, CAPE from July 13th to July 31st, and the CCSLC from August 5th to 7th. The provisional allowance for students writing CXC CSEC examinations is currently ongoing. Those students are allowed to go to school to interact with their teachers to finish any units or topics which they need to complete. I want to take this opportunity to say thank you to all stakeholders who have worked diligently to take us to where we are today. Special thank you to the team at the Ministry of Education, principals, teachers, parents, and students. Thank you very much.
Thank you so much, Ms. Claxton. Finally, I'd like to welcome Mr. Huey Sargent, Permanent Secretary in the Ministry of Agriculture, et al.
Good evening, everyone. The Ministry of Agriculture would like to thank our supermarkets and our roadside vendors for especially, and our consumers, especially for the support that they have given our farmers. We've had a program where we have assisted farmers in terms of water, labor, seedlings, and a variety of other inputs. And our farmers have stepped up, and we have seen where they have very little problems in terms of sales. So we once again want to thank everyone in our general public for their support as we continue to believe in order to help beat COVID, you must be strong. And the local food helps to boost your immune system. So we think that we should fare very well should we get that second wave. Additionally, last Friday, we would have commissioned a 20,000 gallon water tank that we would have gotten from the Nevis Water Department, and we want to thank them. That tank is situated in the New River area. So that area was chosen specifically because it has the highest concentration of farmers on the island. And we are trying, with the assistance of Mr. Floyd Robinson and the Water Resources Management Unit, to take as many farmers as possible off of the regular water supply from the water department. So that is one other project. We also are going to begin again the seedlings and seed distribution. We would have had to halt because we were running low on supplies, and we needed to be able to have some level of reserve in order to continue our program. We have recently realized, or we have recently been informed, that our seedlings that we had back ordered are now in the Federation. So we can now begin our distribution once again. Indeed, it is very important that we continue to feed our people. Our borders continue to be closed, and the impact from the lack of other economic activity is proving to be quite serious on our economy. And one way of sustaining ourselves is being able to grow what we eat. In terms of our agro-processing and abattoir facilities, they are functioning normally, and the production is very good, so there is no shortage of food from animals or food from plants. And we do have some agro-processing. Earlier in the month, we announced that we were purchasing mangoes at $1 per pound, and we want to thank the general public for their response. The response has been overwhelming in that it has affected the operations of our agro-processing unit, but it is for a short time because, as we realize, the mango season is about to be completed, but we were able to get some mangoes, so we will have some mango pulp available throughout the rest of the year, hopefully. And that's it for the updates from the Ministry of Agriculture. Thank you.
Thank you, Mr. Sargent, for your update. I'd now like to take this opportunity to welcome questions from our media houses for any of the presenters here today.
Monique, thank you, Nevis Observer.
Hi, Monique.
My question for Dr. Julie Nisbet: what impact would the Sahara dust have on persons, and can the symptoms of the dust be confused with symptoms of corona?
Thank you, Monique, for that question. You're asking what effect the Sahara dust will have on persons. Like I said, they will develop symptoms. Persons who have allergies will develop symptoms such as trouble breathing, sneezing, swelling of the throat and the eyes, coughing, watery eyes, stuffy nose. And those persons who are asthmatic would be prone to getting asthma attacks. And those with chronic obstructive pulmonary disease would also be affected. Now, the symptoms of COVID would be some of these things that I have said, so, such as you may have runny nose, for example, coughing, but persons who are affected by Sahara dust would not have fever, for example, but they may have some difficulty breathing. So some of the symptoms are similar, yes, and they can be confused, but with a good history and with the current conditions that we are experiencing, a good clinician should be able to differentiate between COVID-19 and effects of the Sahara dust. So once a good history is given, a good examination, COVID can be ruled out, or the effects of Sahara dust, if that's it, can be ruled out. Thank you.
Thank you, Dr. Nesbitt.
Monique Washington, Observer. My second set of questions is for Superintendent David. What is being done to ensure that businesses are closed within a reasonable time so that persons can get home before the curfew? And also, when it comes to buses, has the regulations changed in regards to the amount of persons they are allowed to carry?
Thank you very much for that question, Monique. I will say to you that the responsibility is on the employer or the manager to ensure that he closes the business by 10 o'clock as stipulated in the regulation. Once you have done so, by midnight, your business should be closed and all your employees should have been home. However, those persons who want to stick it out for the last minute and rush home, they risk the chance of being caught on the road during the curfew period, and they can be summoned, they can be warned. But we're saying do not rush. When you rush, you may get into an accident, serious injuries, or even death. And some persons love their cars so much that once it's damaged, it can be a disaster for them. So we're saying to you, govern yourselves accordingly and to ensure that you get off the street before the curfew period kicks in. So I do hope that I satisfy your question. If not, you can indicate and let me see what else I can say regarding that.
When it comes to the buses, has the regulations changed?
No.
When it comes to the amount of persons they can carry?
No, the regulation still speaks to 2 persons in a seat. So therefore, if the bus has carry 14 persons, there's a 3rd seat. So therefore, you know what that means. You will have close to, and then you will have 2 in front, the driver and a passenger. So you will chop off close like 4 or 5 persons thereof. But the onus is on the bus drivers. And once the police are making stops and the buses are overcrowded and persons are wearing masks, the windows are not open in order for fresh air to come in, that person committing an offense. So I therefore take this time to encourage all the bus drivers and even the ferry operators to comply with the regulations to ensure that we do not have they themselves being summoned or arrested and they will be unable to apply their trade, and also that there will be no new cases on island and to the wide extent in our federation.
Thank you, Superintendent David. Question for Mr. Brian Dyer from Shamika Budgeon of Von Radio. Those returning nationals that you mentioned, are they currently in quarantine? Also, can you give us some feedback as to where they were traveling from?
Thank you for that question. We have some returning nationals. They are being quarantined in a government-run facility, and from our records, they were returning from the United States of America and Antigua and Barbuda.
Thank you, Mr. Dyer. Question for Ms. Brown from Shamika Budgeon of Von Radio. With the shortage of rain, is there currently water rationing on Nevis? If so, can you list out the areas on the island?
Hi, this is not Ms. Brown, but this is Floyd Robinson, Director of the Water Resources Management Unit. We are currently, and I said we, but let me just make a quick distinction between Water Resources and Water Department. Water Department are the ones who are currently carrying out the rationing Water Resources is primarily responsible for overseeing the overall water availability to the island, for the island. And so basically, I'm kind of speaking outside of my department right now, but currently there was an island-wide rationing that was going on. Typically, the capital center, the town center, is the only area that usually is not turned off because, for obvious reasons, the hospital, the police station, and the fire station. And so currently, it's an island-wide rationing that's going on. We have relaxed it a little bit because over the last couple of weeks, we have seen an improvement through the appeal to the general public about conservation, and that's part of the reason why we're here this afternoon in terms of water resources, to just make sure that people are getting the message, because it's challenging right now. We do have the COVID pandemic that is causing us to use more water in order for us to stay healthy and clean, and then you have the drought, and then now with the Sahara dust. I mean, if you have asthmatic children, like I know personally I had, you are tempted to dampen and wet the area and wash down more often because it's sometimes a life and death situation. And so what we're appealing here this afternoon is that you have to use the water, we get that, but let's not waste the water. Let's try to reuse the water as much as we possibly can. So like I said, currently there was an island-wide water rationing, but it has been eased a little bit. And by saying that doesn't mean that we must go crazy and start wasting water. But as we see an improvement, that we try to not turn off as much as we would have done in the past. Thank you.
Thank you, Mr. Robinson. Von Radio, Shamika Bajin, I'm aware that some persons still do drink pipe water. Can the Sahara dust affect the water quality?
Thank you for that question. That's a very good question. There's very little chance of that happening because the water system that we have is a closed system. So most of our water comes from underground, groundwater, and it's piped directly up to reservoirs which are locked tight and distributed to consumers. And so our system is a closed system. Now, in addition to that, we chlorinate as a precaution. So if perchance the water gets contaminated, we have a first line of defense to chlorination that would deal with any contaminants. Thank you.
This is the last question from Von Radio. The question is for Ms. Zanella Claxton, Shamika Bajin of Von Radio. Thank you for updating the public when it comes to the Microsoft team. You gave a detailed report on the primary schools here on the island. What about the high school children from Forms 1 to 4?
Thank you for that question. During my presentation, I stated that Gingerland Secondary School has been onboarded, and they started their sessions with their teachers last Monday, and that Charlestown Secondary will be onboarded shortly, and that would include, of course, students from Forms 1 to 4. Thank you very much.
Thank you, Ms. Claxton, and thank you, Von Radio and Observer. I'd now like to say thank you to all our presenters and to our media houses that joined us today for this briefing. I also want to remind persons to stay safe by washing your hands with soap and water and take into consideration the video that would have been presented about how you can conserve water while you're doing so. Cover your cough and sneeze. Avoid touching your eyes, nose, and mouth with unclean hands. Disinfect touch surfaces and areas often. Eat vegetable fruits. Drink plenty of water and exercise often. Continue to practice physical distancing and stay at home if you don't need to move about. Of course, we have our hotline numbers that are on the screen. And I encourage persons to still sign up for the Nevis Health app. Be prepared. It's another measure to protect yourself and to self-monitor for COVID-19. And I also give additional thank yous to the Nevis Disaster Management, Nevis Television, Caribbean Digital Display Limited, Cornerstone, and task force members for making these briefings possible. I am Nadine Carty-Keynes. Please join us on Mondays at 8:30 p.m. for another Nevis COVID-19 EOC briefing on Nevis television on Tuesdays on Von Radio at 1 p.m. Thank you for viewing, and please do stay safe.